Hi, everybody. Welcome to GW Center for Integrative Medicine YouTube channel. Today we have a super special guest. I'm so excited. Delia has been a friend of mine for, I don't know, what, 20 years? Something like that.
Something like that.
So let me do a formal introduction because it is quite fascinating what she does. So Delia Chiaramonte, we say it Care-a-mon-tee. I'll make sure I spell this and everybody has a full exact name that can be read in the description. She's an integrative palliative medicine physician, and of course, we can talk all about that, what that means, and the medical educator. She's the founder and the CEO of the Integrative Palliative Institute and the host of the Integrative Palliative Podcast. Dr. Chiaramonte is a board certified in family medicine and palliative medicine and certified by the American Board of Integrative Holistic Medicine. She's an adjunct assistant professor at the University of Maryland, where she teaches both palliative care and integrative medicine. Her prior positions included Associate Director and Director of Education of the University of Maryland School of Medicine Center for Integrative Medicine and Division Chief of Integrative and Palliative Medicine at Greater Baltimore Center at Gilchrist. Dr. Chiaramonte has been voted the top doctor by her physician peers and has published textbook chapters in the field of integrative and palliative medicine. She offers CME, that's a continuous medical education programs, to physicians and other clinicians on the topic of integrative symptom management. She's the co-author of a Coping Courageously. I have it. We're gonna like that. We're gonna talk all about the book. I just finished reading it. Coping Courageously, a heart-centered guide for navigating a loved one's illness without losing yourself. And of course, I'm going to put multiple different links to her personal website, as well as link to the book where you can purchase it. And with that, Delia, I'm so happy you're here. It took us a while to get together, but we're doing it. Yay.
We're doing it. Thank you so much for having me.
So, when I was kind of planning on where to start, I thought, let's just start straight with the book, because I just finished reading it on a plane from Europe. It's such an easy read. I think I kind of went through it in about 4 hours. It's a dense book, not in the sense of the actual reading. It's easy to read, but in terms of how much you have to process and how much it's relatable to every one of us. I think particular to those of us who have relatives who are getting close to that point where they'll be moving on, and of course we're all asking questions. We're all thinking about our parents, obviously. So, what made you write the book?
What made me write the book, I think, were two things. One was a personal experience that I had with one of my children who got injured. And that was my first experience in caregiving and how completely disruptive it is. And even as a physician myself, and my husband is also a physician, there were so many things that we just didn't know how to cope with, and we couldn't find a guide. So I think that was the seed of the whole thing. And it made me realize how important symptom management is for life, for just living your life, for your family working, for someone's mood to be okay. And so much of medicine is focused not on symptom management, but is focused on, in the conventional medical world, disease and, trying to fix disease, which is great and wonderful unless you can't. And then in some parts of the integrative medicine world, where I also had spent plenty of time, there's a great focus on prevention, which is also wonderful unless you have a thing, and then prevention is no longer your primary concern. So that helped push me towards the field of palliative medicine, I think. I had already been working in hospice and I loved it, but I really just got in my soul the importance of managing symptoms and helping families cope with, what if someone is distraught and hopeless? What if you can't figure out how to get the right medical care? What if your other family members are falling apart too? Like, how do you deal with that stuff? That's not stuff that you often get help with. And it's not just about go see a therapist, because there's really medical parts in it too. So that was the seed. And then I ran this wonderful integrative palliative medicine inpatient and outpatient program. And I saw two things. One was some family members of people with serious illness completely fell apart. the families got fractured, everybody was fighting, everybody was in their own little corners suffering, but they weren't coming together. And then other families who had the same kinds of diseases, equally serious, did not do that. They were closer. They were almost, in some ways, although they were sad, more joyful. They were really living in the moment. They were enjoying each other in a way they hadn't before. And I was so struck by the disease is the same. So it's not about the disease. It's something else the families are doing. And I learned from what the coping families were doing, and I started teaching that stuff to the not coping so well families, and they did better. And it made me really feel like I wanted to share what I'd learned from my patients with everybody else.
Yeah. Yeah. I mean, I think like when I was reading, pretty much almost every page has a case. I personally love it. I feel like it's just like, that's how we work, right? That's how we learn. We learn from each patient. You brought all your wisdom and all your experiences to the book. I want to read something from chapter 5. I like the titles of some of the chapters, like this one, Accept Like a Badass. We often see patients, I think, who are really struggling accepting bad news. And so each chapter has this pearl of wisdom that's conceptualized in a very easy to read manner, so I just want to read this just real brief because it kind of struck me as something very personal. So expect that. Expect when you read the book that there are going to be pieces that you're going to read 10 times because they're going to strike something internally within you that you've seen it. You don't have to be a physician for that. Just live your life. I had been Nick's doctor for more than a year. He usually came to the office with his girlfriend, Nina, who kept a notebook with questions for Nick's doctor in her purse. Nina was on top of everything. She knew which chemotherapy Nick had tried and what the side effects had been. She kept a track of everything, et cetera, et cetera. We used to joke that she was an honorary nurse or a doctor. Nick adored her. But this day, Nick came to his appointment alone. When I saw him in the exam room, I was thrilled, vastly different from the last time I'd seen him. His posture was straight and his voice was strong. He looked robust. He had advanced cancer and was responding to new treatment. He looked great and he seemed to be feeling like his old self again. And Dr. C, can I tell you a secret? He asked me excitedly. Well, you. Of course, I said, once I'm clear for a full year, I'm going to propose to Nina. And so then you take this, well, why sort of this 2 points. One is, well, I'm amazed that you look so great, wonderful, but why wait? Sort of this point that I think for me stands up in every visit quite strongly. Often people plan things and they forget to live in the moment.
Yes.
I think that's kind of a summarize for me the whole point that you're trying to relate to people in terms of we're all going to suffer one way or another. Life is not an easy, but those moments we shouldn't forget in any one of them. As you put out, get the flowers out of the poop and do it now. Like this is like, for me, that's a core. And then each piece has this very, very practical suggestions. Why did you decide to do that? It almost looks like there's going to be a text, but then there's going to be like, and here some specific tools. Tell us a little bit about that.
Yeah, I did that because I really think there are two things that we need to do in order to cope better with a practical, difficult situation that's in our lap. One is we need a different awareness often, like focus on the now instead of putting things off for the future. Accept what's happening so that you can say the things to your loved ones, so that you can do the things you want to do, so you're not putting things off for the future. But then also you have to actually do things. You have to have some skills. So I felt like if it was too theoretical, people might feel like, well, yeah, but how do I have that conversation? So, for example, there are parts in the book, as you know, that are about here are the important conversations you need to have. And people could say, okay, I believe you, I should have that, but I don't know what words to use. So I gave words. Start this way. Obviously, you can do it however you want, but if you feel like you can't start, you could literally read these words to get the conversation started. So I wanted to make it as practical, change the outcome of the person reading it as I possibly could.
I honestly think, I love that you put the word guide, because to me, the book read more like a desk reference. Like, yeah, there are all these cases. It reads like a story. It reads like continuous. There's no I mean, there are pieces as, practical pieces, suggestions, but, you can either skip them or you can just, mark them and come back to them at any point.
Right.
But the whole idea almost feels like it's a book that should be, it will always be on my desk as a reference, basically. Like if I get to, one thing we did, we're coming back from the skiing and I said, okay, now everybody rate from 0 to 10. How, and it was funny because we all have pretty different numbers. Kids were like, fighting between 6 and 7. And I'm like, what 6, 6, 7? It's like 9 to 10. What are you talking about? And Angela's like, no, it's a solid 8. It kind of pushes you to continuously stay mindful of every second that is important.
Yeah.
Every second is important. But when the illness stares in your face, I think it just becomes so much more obvious.
I think this really is a human book for all humans because we're all facing mortality, every single one of us, and we know that. So while it's maybe for some people it's more in their face when someone that they love is sick, honestly, I think we should all hold it near to us, not so that we're scared or freaked out, but so that we don't forget to be happy as much as we can today. Because, people sometimes say, oh, palliative care must be so depressing. I actually found it to be totally the opposite. It was the most wonderful reminder every time I saw a patient not to waste today. If I'm feeling like, oh, they didn't invite me to lunch, or, I gained 5 pounds, or that person wasn't nice to me, whatever. Like, who cares? If you knew you had cancer, an advanced cancer right today, you wouldn't care about those things. So don't care about them now, because we'll all be there one day, and putting off happiness and connection and talking to people and experiencing things and having new places to go and trying new foods, don't put off any of it, because none of us know how long we have. And I think the whole message is live today, be open-eyed, and then come to today with your whole soul and open heart and live it the best way you can.
So integrative palliative, let's digest the concept. I mean,
Sure.
you and I understand it, but I think it's important for listeners to get into it. So I don't know, did you coin the term, or it's just kind of spontaneously came to you? I mean,
so here's what happened. I was in the integrative medicine world for a long time, more than a decade, at the University of Maryland as the associate director, as you mentioned. And then I was practicing palliative care. And it was so clear to me, these are the same philosophically, right? Whole person care of the patient and the family. And the difference from my perspective, if I focus on the palliative side, which is, as you well know, but some people don't know, not end of life care, but just care of people with serious illness. The thing that really struck me is all palliative care should be integrative palliative care, because philosophically, they are very similar. But there are tools in the integrative medicine realm that are simply not used in conventional palliative care, and that's nuts, right? If we know that helping manage somebody's anxiety and depression will help manage their pain, and palliative care doctors know that, why on earth would we only use meds? Why wouldn't we also use acupuncture and guided imagery and meditation and exercise and all the other things that are shown to manage anxiety, depression, and pain? So it's just a bigger toolbox, whole person care for the patient and family if they have serious illness, with a bigger toolbox. That's the basic idea.
I mean, theoretically, palliative, especially hospice, like if we talk about specifics of hospice, they're supposed to cover anything, right? I mean, they're supposed to, by their way they operate, they get paid per day, and they're supposed to use that money for whatever the patient needs. And yet, just as you put out, I mean, it's all meds for most part, face it, right?
Yep.
I mean,
Yep.
I've had slew of patients over the years who say, I'm not going to sign up for hospice because they're not going to offer me what I want. They're not going to offer me acupuncture. They're not going to offer me massage. They're not going to offer me medical cannabis. They're just going to offer me drugs. I don't want drugs.
Right.
We just finished doing the review article on geriatric oncology for a journal. And I wrote there a little bit of a paragraph about integrative palliative. I said, look, why in China, every patient with cancer able to get acupuncture, but how are we different? The data is all there.
Right.
And the data is strong. Quality of life is definitely improved with acupuncture, but we're not offering it to our patients. So I think, so you started championing this field a long time ago, but It recently came, obviously, in the form of the kind of almost like a summary of all your experiences in the book, but also you found this institute,
Yeah.
the Integrative.
Yeah,
Talk to us a little bit about it.
exactly. So I practiced it first for 4 years in this integrative palliative group, inpatient and outpatient. And we did have an acupuncturist, as a matter of fact, not just outpatient, which is a little bit more common. We actually brought the acupuncturist into the palliative care team, and it referred internally. We got a little grant to do this. So our team would refer to our acupuncturist when someone had uncontrolled pain or nausea or, constipation or couldn't sleep or whatever. And I was shocked at how sometimes we use plenty of meds. We use plenty of morphine and other meds. We couldn't get the patient's pain controlled, but then the acupuncturist would go in and would get the pain controlled. The whole team was blown away. So it isn't usually used because it's not covered inpatient, but it should be, no question about it. So what I saw was this works. This integrative palliative approach, this combining the complementary tools into a standard palliative care approach works. And in my opinion, it's better than having them separate. So when I worked at the University of Maryland, we had an inpatient integrative medicine team. So that team would do acupuncture, would do Reiki, would do mind-body tools, et cetera. But we couldn't prescribe meds because there was a separate palliative team. And the patients did not get nearly as much help because sometimes you need meds. You do. Morphine's great. Sometimes you need meds. And really, it was the combination of both that is what helped. And that was what I personally learned from my experience, because my daughter, who got injured, needed not just complementary tools. She needed other things, injections, surgery, et cetera. The combination, very medical and complementary tools together, is really what worked. And so that's what I learned. And then I felt like, here I am in this small little place, seeing however many patients we can see, me and a nurse practitioner and the mind-body specialist. But I want everyone to know this. I want every palliative care doctor to know this. I want every physician and clinician who takes care of seriously ill patients to have this perspective and learn these things. So that's why I thought it was important to start the Institute, which is basically for education, and to have the podcast so that people can access it for free, because I want clinicians to think differently. And I want them to take care of the whole person when a patient has serious illness, the whole family, and I want them to use all the tools that work. So that's my little soapbox.
I'm just amazed that you're doing this. It's so much work, not a lot of pay. And
It's true.
we talked over the last couple of years as this is all becoming a reality, how much you put into it.
Yeah.
So I mean, I'm glad that it's going. I hope that everybody buys the book and it'll become quickly a bestseller, and it'll propel the Institute forward as well.
Me too.
Tell us what you're working on right now. I know the Institute has all kinds of CMEs and all kinds of activities. You have a very, very active Facebook. I try to contribute.
I appreciate that.
But what's your current active, fascinating thing you're doing?
Yeah, the next thing that I'm doing is a program for families who want to go deeper than the book, because my feeling is that some people will read the book and feel like, oh, I get this, but now here I am, I read the whole book, like here I am all by myself, now what do I do? And there, of course, are many more things that I could teach. You just can't put all the things in a book. So I'm currently working on a recorded program, and maybe there'll be some sort of group component if people want it, just so that people aren't all alone with this, because my feeling is it's a new perspective of how to approach illness. And I feel like when you learn new perspectives, it's nice to do it in a group. And it's nice also for people to see my face and to hear me speak, even if I can't be in their living room and, be caring for them. But seeing me on video, I think, will be a little more intimate and personal. And then if we can gather a group of people who want to cope courageously in this way, I feel like it's my way of contributing to the world. In the book, it talks a little bit about legacy and what that means to a person as they're going through their life or as they're coming to the end of their life, to have contributed in some way to this world. And I feel like for me, that's what this is.
You were so vulnerable in the book, going so detailed about your daughter. I actually, I knew surface of it, obviously, since we talked, but I didn't know how deep this was, and sort of how much you guys were all affected, and sort of how much her life went upside down. And and it feels like through this, you became not just kind of a master of the saying, we're going to get through this, like as you, I think you put it, as a captain of the ship. I think that's the words you use. But it also taught you, when someone doesn't, I mean, there was no obvious answers for anything. I mean, she had I can say, because it's in the book, she had a pretty bad concussion, which actually was missed, right? I mean, they originally said, oh, she's fine, whatever.
Yeah, they were, concussion, 2 weeks of brain rest, then she'll be fine. So it was post-concussive syndrome that just nobody seemed to know what to do about that.
Right, but it's dramatically affected her. And then when I was reading, it struck me that right now we have all this millions of long COVID patients. It's a kind of the same story.
Yes, absolutely.
It's a condition where, we sort of know something, but actually we don't really know anything, and we're just kind of creating the process. And so you and I talked a little bit about taking some of your experiences you've learned there, and trying to say, look, what can we do for this rapidly growing population? So I think this is really the template for the long COVID. We've actually been doing a little bit of, I'm going to make everybody in long COVID group buy this book, so that they all
Good.
Well, because the framework of some of the tools is so effective, and it's easy to get out of the book. And I think it's going to help people to start really grasping with the reality and moving forward, instead of in this kind of a constant self-pity and upset state, but really becoming more practical and more courageous. I mean, I think that's really the word here, And we've been trying to foster it in our group, but it's not easy.
It's not easy. It's not easy. And I learned it myself when we were with our daughter. It was really a 3-year plus experience. And the thing is, when you're in it, you don't know the end, right? If you knew the end, maybe you could cope with it, but you have no idea. So you have to try to make things better, have no complete uncertainty about what's going to happen at the end, and then cope with the actual things you're dealing with. So, she was so upset, in so much constant pain, screaming all the time. We have another child. I have a husband. I was working. He works, is all the things. And so that experience of being within some kind of suffering, but having some tools to try to make it better, other than you have to fix it. And that's how I think it's very relevant for the long COVID people. So when people are like, well, I'll go to another doctor, I'll try another medicine, I'll, do this other thing, which doesn't necessarily work, it puts off the coping today. Like, well, if I just find the right doctor or pill or surgery or medicine or whatever, then everything will be fine. That way of being increases suffering. And so what I really learned, and what I saw also with my patients who were going to die of their disease probably, is that you can have symptoms, you can be suffering, but you can also have tools today to reduce your own suffering, even though you don't have an answer to fix the thing. So I think you're right. It's very appropriate for long COVID people for exactly that reason.
Yeah, you and I, we approached some of the publishers to say, look, let's write a long COVID group. Long COVID. Yep. I don't think the world is quite ready for that yet. We'll get there. I think with your experience, we'll write some. You were talking, and it struck me that there's one very uncomfortable topic, and you and I actually probably one of the very few, well, maybe Stephanie Chang and a couple other people who can do this in our field. So let's be a little bit skeptical of our own colleagues here, without naming anybody. In our own field, I think we often get this idea that we can fix everything, that integrative tools can take serious illness and turn it around. And when people come to us, as you said, looking for a magic pill, magic tool, whatever.
Right.
And I think in our field, there's often this a little bit of a unrealistic expectation where people they don't know when to switch way of thinking from, we'll find a driver, we'll find a cure, we'll make you better, to let's not go there. Because it's really unrealistic. And let's face it, let's help you because we have all these tools, all these integrative palliative tools. Let's just make you live your life, whatever it is that you have, and live it successfully, live it more comfortably, get it to a point where you can feel that it's all worth it, because we forget that. And I always seen you as a champion of this fine line and how to. So what I really hope that your one of your big projects in the future is going to be that we're somehow going to mandate every integrative doc take your courses, because that's where
Hallelujah.
there's an often kind of the hole there, you know.
I am so glad you said this, because I feel like this is like a secret thing that I have in my head that I'm not allowed to say out loud. But since you said it, we can talk
I
about
see.
it, right? Here's the thing. This was what really struck me when my daughter was struggling. We had been to a bunch of doctors. She went to a doctor who finally said, I think I know why you've had, 9 months of 10 out of 10 pain in your head and it won't get better. I think it's your neck. We're going to do steroids. We're going to do injections. If that doesn't work, we're going to do surgery to release your occipital nerve. So that was the first hope she'd had in almost a year. Then, just because we were doing all the things, we went to an integrative medicine physician, a very good physician who I respected. And the message there, though, was to her, she was 12 now, right? So she doesn't have a lot of frontal lobe at this point. The message was, oh, don't do steroids, don't do injections, don't do surgery. That's way too aggressive. All you need to do is get the mold out of your basement and stop eating sugar, and all of your pain will go away. And now I'm in integrative medicine at this point, right? I'm the associate director of the center. I had a whole career crisis because he made her, I shouldn't say that, that doctor made her worse than any of the conventional doctors, because that doctor just took away the hope that she had from the conventional doctor that he was going to help her.
Mhm.
And she knew, as much as she was suffering, and I knew, that stopping eating sugar and taking the mold out of the basement was not going to fix her. So that little interchange harmed her. And I had a whole career crisis of, oh my gosh, is this even the right thing? What are we doing here? How could the integrative doctor be the one that gave her the most distress in a kind of benign thing? Stop eating sugar. But the whole depth of suffering that she was, and hopelessness that she had, really was impacted by that. And it made me really see how important it is, as you mentioned, to look at the whole story. Stopping sugar is great, but it doesn't fix all the things. And we have to have a real understanding of prevention, which is amazing. Treatment of inflammatory only conditions, sure. But some things aren't that, and some things are unfixable. But we can still be there for the patients, and we have all kinds of tools to help them cope. That's the symptom management, integrative symptom management component. So I agree with you. All people in integrative medicine should learn the whole spectrum, including the integrative palliative approach.
Yeah, I mean, I think we often forget that the human psyche capable of finding directions of healing that are completely beyond our physicians' capacity to help them with.
Yeah.
The answers are often come way beyond our individual knowledge or our individual strive.
Yeah.
You know, I'm gonna ask you this. If you don't know the answer, it's fine. Yeah, I've been getting involved more and more into this whole psychedelic cannabis and psychedelic world. And I do think
Yeah.
there is a massive pearls of wisdom, because they are allowing patients to find those directions of self-healing, to find
Yeah.
those. I don't think that they heal things, but I think they're allowing us to open our view to possibilities that are beyond who said what, that they're deeper intuitive and, if you will, downloads from beyond. How do you see this being gradually merged into the palliative world?
I love that question. It's a place that I really want to increase my own knowledge, because I think there's a tremendous potential value in a couple different directions that I just think about. I'm from an uneducated place, but this is what I think. One is the whole existential fear of death, and what does death even mean, to be here and not be here? I think having a non-linear approach to thinking about this incomprehensible thing, I think, can be tremendously valuable. And then I also think that many people bring traumas from their past that they've kind of held, under the water for their much of their life. But as they are coming towards the end of their life or dealing with something that is causing tremendous suffering for them, it raises up its head. And I think that processing of traumas and what happened to me and who am I on this earth, all of those things together, I think can potentially be very helped by psychedelics too. It's a great, great new development, I think.
Yeah, I mean, you and I probably will come back and do something in the future on this topic, especially since we think that MDMA is going to get FDA approved in a few months. So
Yeah.
and it is getting FDA approved for the PTSD, but there's going to be a significant use of it probably in end of life, especially towards like the last days and weeks when there's just sometimes horrendous existential crisis people struggling with. So you talked about what you're doing now. What's next? I mean, after you create the groups, you got all these big plans. What's next?
That's a great question. I think what's next is spreading this concept out more widely and making a community. That's what I want. And I don't even know yet what is it called, that community? In my mind, from a clinician perspective, I feel like it's sort of sage physicians or sage clinicians. Like, what I would love to have is a community of people who see the world this way. And I think at one point, maybe integrative medicine was that, but I think it may not be that right now. Just learning about functional medicine, which is crucially important and helps a lot of people, is not necessarily this kind of philosophical way of walking through the world as a human and as a healer. So I would love to make some kind of community around that from the clinician side, and a coping courageously kind of community from the patient and family side. And that one is really about open eyes, an open heart. That's how I see it. Like, whatever's in front of you, face it. We're going to talk about the things. We're going to say death. We're just going to say all the things, and we're going to fill ourselves up as much as we can so we can bring healing presence to this really tough experience and kind of walk it together so people don't have to walk this tough road alone. That's my big fantasy.
Yeah, you said something so profound. I just realized in the beginning, 20 years ago, the integrative field often used the word holistic. And I think there was this sense of holism in what we used to do.
Yeah.
People like Rachel Raymond and, and Bernie Siegel and
exactly.
Wendy Kohatsu, all the sort of people who've been long time at it. And so where did we lose this? Why is that? I don't think it's just functional medicine. I mean, I think I don't know what it is, but you're right.
I think we tried to medicalize it and put it into a box that physicians felt comfortable with. Let's talk about enzymes and processes, and which is great. That's important, but it a little bit lost the soul of it.
Yeah.
I agree.
Yeah. Well, I think I'm so impressed that you've started this. I hope that this path of yours will help us to sort of come back and say, we should be doing this holistically. We should be doing this in the way you're teaching. Yeah. I think I'll take on to remember that, because I think in a busy day, I'm catching myself often thinking like reductionistically, just because it's easier.
It's easier. Yeah.
It's easier.
Yeah.
But I think if we do that, we are losing the soul of how we've been practicing and what our field has originally set to do, kind of bring that holism back into the Western model, which totally stripped it from the current, our current way of we teach our students and everybody, and the whole model became, financially driven. We call patients customers now.
Right. No, you're right. And of course, everything that I say for integrative palliative medicine is appropriate for every patient that gets seen. The one advantage of, in my opinion, starting with palliative medicine is that the conventional medical world doesn't fight back as much, because nobody's curing these people anyway, right? So the whole field is specifically focused on symptoms, and there's really no argument. Whereas if you say, oh, cardiologist, your patient doesn't need those Lipitor because I'm going to give them this herb or red rice or whatever, they'll fight back. So in palliative care, symptom management only, no one cares. You want to do something to make our patients feel better? Great. So that's one advantage of starting anyway in that realm.
Yeah. Well, good. Good. I'm excited. I'll see you in person in a couple of months when we get
Indeed.
to Cleveland. You're teaching something, I hope.
I'm
There.
not, unfortunately. No, I submitted, but did not get accepted, unfortunately. I wish. Yeah,
You know, we'll have a good time.
we will.
So,
Thank
all
you for
right.
this.
So everybody, this is Coping Courageously with Delia Chiaramonte. I make sure that we have links to this. Make sure that we have link to your institute, to your personal website, and we'll have you back in a while.
Love it.
To sort of catch up, see where things are. Meantime, thanks everybody for listening. Subscribe if you like this channel. It helps the channel. It helps to move the old information forward. And we'll see you soon. Bye, everybody.